we're getting into this. We've done the business impact analysis, the BIA. We've tiered the applications. What are some of the roadblocks? So we've tiered the applications. These are the ones we need. I assume it's the EHR, it's the ERP, it's the PACS system and whatnot. We need to make sure these are up in the time of an emergency.
HL7.
Right, integration and whatnot. So what are going to be some of the roadblocks as we start down this path that health systems are going to have to overcome in order to operate in the cloud?
Well, I'll take a first shot at some of that. I mean, some of the things that we've ran into have been some of the EMR vendors were, taking their time to work through and understand what the cloud was going to mean for them, which that took some time. I think we'll still see a lot of the departmental applications be problematic because maybe smaller organizations that are providing those, they're not really sure how to support and handle that in the cloud. And the interface engine has a potential there too, just because of the fact that there's a lot of IP to IP. There's a lot of technology there that is maybe rooted in things that aren't as easy to change IP addresses or make that jump to the cloud. So we're really approaching a lot of that in a hybrid so that we can accomplish and support both the applications that can go cloud native with us as infrastructure as a service, or support things that need layer 2 spanning or other deep technical needs to require that, but to really cover both sides of the needs and ensure that they can operate.
Yeah, I would add, I completely agree with everything Josh said there. I think in addition to that, there's a lot of internal training and assessment of your team's capabilities to sort of figure out what you can do on your own and where you're going to need help. I think the average health system that's moving into this space probably doesn't have the internal people who know exactly how to do this. Their teams aren't necessarily used to working with applications in this kind of environment or this kind of infrastructure, and it is a different way of managing things. So you have to work on that assessment and then educating your teams and bringing in the right additional resources to help you.
I completely agree with everyone. I think we have a number of legacy applications in this industry that can be very challenging to port to the cloud or even not even capable. And when I work with some of our customers or even some of my personal experience, there just isn't a replacement for some of these technologies. There's some technologies that have embedded XP that they just don't have a replacement because they haven't built it on a modern day operating system. So the hybrid environment that Josh is talking about is going to be critical, I think, in the interim for the next month. I worry about the skill set and the flexibility because we know there's a national shortage of that. But I think that the offset of the cost will help organizations recruit and build that kind of technology. The EMR providers can be very protective in terms of the platforms that they support and allow, and also where their intellectual property's at. And that's appropriate in some cases, but I think that causes the industry to struggle with agility. And then something we haven't really experienced yet in the healthcare industry, but we see it in others, is that once you put all this effort into a DR in the cloud scenario with provider A, let's say it's Microsoft Azure, you have this tendency to get a lock-in too, so that they can manipulate or manage the pricing. So you have to make sure that you have the flexibility to be able to change out those utility companies, if you will, in this new model. So it's something that we're all going to have to evolve to work together and support. But the benefits far outweigh those costs and risks, I think.